Talk to me a little bit more about the detoxification.
If you are living in a moldy environment and you are trying to detox mold, the analogy is kind of like you're standing under a shower with a towel trying to dry off. You're never going to get dry. So it is important to know, is my home a safe place for me before doing, tons and tons of detox.
Hello and welcome everybody to the Patient Advocacy Initiative podcast. I'm your host, Dr. Asha Bohannon, and I am truly excited about having my guest on here today. She is a naturopathic physician and the owner of Sea Change Medicine in Portland, Oregon. She specializes in mold illness, detoxification, and GI issues. She works with patients and clients one-on-one in an individualized wellness program. And her goal is to really educate and empower her clients to become a picture of ideal health and a source of inspiration to their community. And personally, I know this from personal experience, she does just that. She's in awe of the human body and its capacity to heal. And I always share one fun fact with all of our watchers and listeners. But one thing that she is a lifelong student. She loves learning new things, and she's been taking Spanish for over a year now, and she's getting back into skiing. So please help me welcome Dr. Kat Bodden to the Patient Advocacy Initiative podcast. Thank you so much, Dr. Bodden, for being here.
Thank you for having me, Asha. Please call me Kat. Everyone can call me Kat or Dr. Kat or whatever. But yeah, I'm so happy to be here and speaking with you today.
Yeah, I am so excited to have you on. So Dr. Kat is a huge part of my own personal health journey. And I want to start with what really grabbed me about you in the beginning, which is your 5 pillars of health. So I'd love for you to describe what that is when it comes to working with your clients.
Yeah, absolutely. So my practice is really based on my 5 pillars of health, and they're nourishment, detoxification, gut health, movement and mindfulness, and mentoring. So nourishment, food really is foundation, but every body is unique. I have general dietary recommendations really about eating a diet that's whole foods based, rich in colorful fruits and vegetables, ideally eating food that comes from a farm, not a factory. But, what works for one person doesn't work for everyone. And so through working with my clients, we figure out what is the food that's best for them in their individual situation. I do meal planning and recipe guides and things like that as well. And so, nutrition is important. We want to make sure people are having a good blend of protein, fat, and carbs. But I use the word nourishment because food is also such an important part of, connecting with people. It should really, nourish our souls as well. And so I don't want people just, focused on what they're eating, but also how they're eating, and they shouldn't feel deprived. My choices are delicious, health promoting. There are like snacks and treats involved, but maybe these snacks and treats don't spike blood sugar super high or full with kind of icky chemicals and ingredients, and things like that. So that's nourishment. And then we have detox. So, we unfortunately live in a really toxic world. Even if you live a super clean lifestyle, there's toxins in the air we breathe, the water we drink, what we put in and on our bodies. And so everyone can benefit from a detox. And detox isn't about just drinking green juice or detox teas or, getting hooked to an IV. It's really about stimulating our body's own detoxification processes. So this is working on the liver, the kidney, the gut, the lymph. And after a thorough detox, people often report improvements in energy, clearer skin, better mood, and they just feel more vital. And then gut health. So gut health really is the cornerstone of my practice. Even Hippocrates said back in, I don't remember what year, but, thousands of years ago, he said, all disease begins in the gut. And so we want to work on digestion, making sure people are able to thoroughly break down their food. They're having good eliminations, as bowel movements are, one of the main ways our bodies get rid of toxins. But our gut health is so much more than digestion. It's responsible for mood. Like 90% of our serotonin is actually made in the gut. So if someone has feelings of, anxiety or depression, my answer isn't just to give them a medication that increases serotonin and kind of send them on their way. It's to go one layer deeper and think, why is their body maybe not making enough serotonin in the first place? How do we fix that? Our digestion is also our gut health is also important for our immune health. 70% of our immune system is actually in the gut. And then, of course, you know about the gut-brain connection and the importance of the microbiome. And yeah, gut health really, I found like optimal gut health really is essential for optimal well-being. And my fourth pillar, movement and mindfulness, or M&M. You know, exercise is so important. I'm sure your listeners have heard just the importance of exercise, you know, from the beginning of time. But if you don't feel great, it's really hard to get moving. So this isn't about just joining a CrossFit gym or walking on a treadmill just to burn calories. You know, this is really about finding ways that you love to move your body and making it part of your daily routine. It can be walking, gardening, dancing. Like, I don't really care what it is as long as you're moving. But for some people, you know, we have to get them feeling better and then get them moving. You can't just expect someone who has, you know, debilitating fatigue to go out and start walking, you know, for 45 minutes every day. You've got to boost them up a little bit. And then it's important to move, equally important to find stillness. Mindfulness is a huge part of my practice, and I use some targeted therapies that directly target our vagus nerve. That's the biggest nerve of our parasympathetic nervous system, the part responsible for resting, digesting, and detoxing. And then lastly is mentoring. And this is what I really find is the most important of all. And often what's missing with working with other practitioners is, you know, I only have a few spots each month available for new clients because I want to be readily available for them. You know, we figure out the underlying cause. I create a unique plan just for them. And then my goal is really to, you know, be there for ongoing support and accountability, encourage them, educate them. I'm here to kind of call people in if they stumble or procrastinate. I'm really here for my clients every step of the way. And so those are my 5 pillars of health and kind of how I built my practice.
I love it. So I'm going to start actually from the bottom up because I want to share with the listeners on that mentoring piece. I subscribe to everything that you said, even within my practice, very similar mentality and philosophies. But that mentoring piece, I know when I was going through all of the health issues that I was going through for many, many years, the one thing that I kept saying was I needed a me for me. And I've told you this before, and I want to share this now is because I pour into my patients, my clients, just like they were my family. And I would do anything for them. I'm there for them. And it was very difficult in our healthcare system to find that these days. And so when I was searching for the answers and what was going on, that mentoring piece really stuck out for me. And you have far exceeded those thoughts or expectations or anything that was there. And so I wanted to start there because I think that's so important to know that there are healthcare providers that are on your side and are willing to do whatever it takes to help you through this health journey or health wellness journey as you're going through it. So I'm going to segue into the mold toxicity and the mold illness because that is near and dear to my heart because that is part of the health journey that I was on. I say part of it because it wasn't the whole entire picture, but it was such a major piece. So I would love for you to share more on that because I probably have learned just enough to be dangerous with talking about it, but you are the expert. And so if you can really share with our listeners today about what the signs and symptoms are, what should people be looking for? And then obviously how those 5 pillars kind of tie into that process.
Yes, absolutely. Okay. Well, first off, I want to say mold illness is tricky for many reasons. The first is that its symptoms are so varied and can affect basically any system of the body. So oftentimes people can be having all of these things, like maybe they have urinary frequency and sinus congestion, but they don't really put the two together, understandably, because they seem completely unrelated. So it really takes a practitioner who's mold literate and has had extensive training in what to look for and how to treat mold, often to get a diagnosis. So a lot of times when people find my practice, they come in with, you know, this list of many different diseases like fibromyalgia, chronic fatigue, interstitial cystitis, anxiety. And those are all really symptoms of the underlying cause, which is mold. So I would say, you know, the top symptoms I usually see people coming in with are sinus congestion, like I mentioned, headaches and migraines, fatigue and brain fog. Interestingly, in the literature and in my training, diarrhea is often stated to be the most common kind of GI symptom. However, I don't know if it's just my practice or what, but oftentimes I actually see more people being constipated, which is problematic in that if we have a lot of toxins in our body and we're not able to get them out, the constipation can make things a lot worse. Urinary frequency, like I mentioned. And then sometimes with chronic mold exposure, people will have more neurological symptoms like zapping or zinging pains throughout their bodies, ringing in their ears, things like that. And it's so hard with mold because sometimes it can happen while a person's living in a moldy building. Maybe it's their house, maybe it's their office. It could also be places like schools or churches. But mold symptoms can also arise years, decades after the initial exposure. So, I worked with people where it was their college dorm, black mold on the walls. At the time they were fine. And then it wasn't until later in life when all of a sudden they started developing all the symptoms. And the reason for this is, I'm not an artist, but I'm gonna have a little quick drawing demo here.
I love it.
Is our health is kind of like a bucket. Here's our bucket. Excuse my illustration. Our bucket is us. When we start having symptoms, it's when our bucket gets filled. So over time, throughout our life, lots of things get added to our bucket. There's pesticides in the food we're eating. There's trauma. There's medications. There's sedentary lifestyle, big mold hit. Maybe people get COVID. And over time, this level starts rising. Bucket starts spilling over, we start having symptoms. So this is why maybe someone had this big mold hit, but the rest of their bucket was really low because they were young, they were active, they didn't have anything major happen, but then they start having a really stressful job. Maybe they go through a divorce, they have a death in the family, and they start having all of these symptoms. So how do we fix this? One, we want to stop adding things to our bucket. We want to avoid toxin exposure. We want to eat an anti-inflammatory diet. We want to move our bodies, all the things I kind of talked about in my pillars of health. But also, we want to punch holes in our buckets. This can be a really quick way to get the water level down. This is through detox. This is through mindfulness. This is through gut health. And a note on detox and mold that I think is really important for people to hear is there are a lot of things you can buy online where it's like a comprehensive all-in-one DIY mold detox kit. You go, you spend however many hundreds of dollars on these supplements, and then you're cured. That's usually not how it works. And if we mobilize a bunch of toxins in our body without being able to effectively eliminate them, like say you're constipated, but you start taking all these detox things and you can't poop it out, it can be really dangerous and people can actually get a lot sicker. So I never advocate for the kind of one-stop shop DIY done for you mold detox things. And I really emphasize the importance of working one-on-one with a practitioner because I've just seen people try and do it themselves and get a lot sicker.
Absolutely. So I'm glad you said that because that was going to be my next question for you if you didn't address it, which is great. So, personally, that was the thing. It was, I didn't know that was the underlying cause of a lot of things. And mine was a situation where it happened years ago. And then the stress of all the things and all the years of, things that I put into my bucket that really didn't need to be there, just pushed it over the edge. And so I'm really glad that I found you the expert to help with these things. And the DIY things don't work. I know I've done it all, tried it all. I mean, literally. And they just don't because it's not getting to the root of the problem. It's not doing it in the proper way. And that's what I love so much about working with you is that it's literally working through each of the pillars, each of the steps, and really customizing it, tailoring it to each individual because everybody's different. Everybody's trauma is different. Everybody's, mindset's different. You're in a different place. And so it really does take that one-on-one individual care to be able to provide the answers. So I appreciate your approach. I think it's amazing. So talk to me a little bit more about the detoxification, because I know I think that's so important. That is something that a lot of people say, oh, I want to detox, or I'm going on this detox diet. Can you dive into that a little bit more?
Absolutely. So one of the, like I kind of alluded to before, one of the most important things with detox is making sure people are having good eliminations. As a naturopathic doctor, I spend a lot of time talking about poop. And just for your listeners to know, like the ideal bowel movement is about like between a foot long and the length of your forearm, smooth in one piece, easy to pass, no blood, no mucus, no undigested food, no pain, and with a sense of completion, oh, I'm done afterwards. That's really rare. A lot of people don't have that every day. And so that's where I start working with someone, is usually around making sure we're getting as close to that as possible. That can be done by increasing fiber in the diet, making sure they're well hydrated. Sometimes we need to bring on some additional supplements to kind of make sure they're having good eliminations. So that's the first phase of detox. Second phase is adding in something called a toxin binder. There's lots of things out there that work well for mold. Depending on the type of mycotoxins, which are the harmful things that mold produces that we're able to test for, depending on the type of mycotoxin present in the person, we can pick from different types of binders. Some examples are activated charcoal, bentonite clay, zeolite, chlorella. And again, we don't want to just start giving someone a lot of activated charcoal without making sure they're having good bowel movements, because the charcoal will make them even more constipated, and then we have a big problem there. So after someone's able to kind of take some of these binders, which really work to help like tease out the mycotoxins from our digestive system. I use the analogy with binders. I don't know if you remember those toys from back in the day, where there was like a person's face and all these metal fillings, and you had a magnet and you could kind of draw facial hair. You could make the person have a mustache or a unibrow kind of a thing with this magnet. The binders are sort of like this magnet that the metal fillings attach to. It's not 100% of a hold, like sometimes they fall off, but you can kind of move the toxins along, similar to like dragging those metal filaments with the magnet. After they get on toxin binders, then we can bring in antifungal support. The two main areas which mold affects in our body and can colonize are our sinuses, because we breathe in the spores and they kind of set up shop in our sinuses. We swallow a postnasal drip, and then they set up shop in our gut. So I often do antifungal support for the sinuses and nasal sprays, and then through the gut with different herbs. Very rarely will I use medications, though sometimes I do. But usually I like to use herbs. I feel like they work a little bit more synergistically with the body. And all the while we're doing this, we're doing lots of lifestyle practices and additional supplementation to support the liver and the kidneys and the lymph. So people can do things like dry skin brushing, contrast showers, sauna therapy if they have the means. If not, just hot baths to get people sweating, because sweating is such a great way to rid our body of toxins, especially mycotoxins as well.
Awesome. I'm glad you brought up lymph too. So I could literally talk to you all day long about all of this. But I would love for you to touch a little bit on lymph, because we know that we have a lymph system. Most people do. And I would love to hear your take on that. And what is the lymph system? And then why are we so concerned with it when we run into this mold toxicity or mold illness?
Yeah. Oh my gosh. I love the lymphatic system. It's so fascinating. So it basically acts kind of like our body sanitation workers. So part of it is responsible for our immune health, and it will, first of all, the lymph, it looks sort of like blood vessels and travels all over the body, kind of like our circulatory system. But unlike the circulatory system, which has a heart that functions as a pump, the lymph only flows with muscle contraction. So this is another reason why exercise is so important. And even just daily walking, like 30 minutes of walking every day, which can be broken down into 3 10-minute walks, one of the best things you can do for lymph. But anyways, so it kind of functions on the immune side to shuttle immune cells all over the body to where they need to go, like if we have an infection. But in terms of mold, what it does is it picks up toxins, sort of like the sanitation workers, and brings them back to our main organs of detox so they can be eliminated. What happens with, sedentary lifestyle, and then you add on toxicity, specifically mold toxicity, is that lymph gets really sluggish. Think about it just like sludgy fluid. It's not flowing well. This means that the toxins can't get cleared back to our digestive system, and they get kind of stuck in the periphery. So people will often have swollen fingers, joint pain, swollen ankles or like cankles. And they'll just feel tight and kind of achy. Another sign of congested lymph is sore throats or like swollen lymph nodes in your neck. And so there's lots of things we can do to help support healthy lymph flow, like the walking, like I mentioned, dry skin brushing. There's certain nutrients and herbs we can include to help with lymph. And then for more serious lymphatic stagnation, I often refer to a lymphatic drainage practitioner, where it's like manual therapy to get the lymph flowing. I caution to that if anyone is listening and it's like, oh, this is me, I need to go see a manual lymphatic drainage practitioner. If you have a very high toxic burden and then you go and get it all stimulated, it basically triggers a big toxin dump, and you can feel really icky afterwards. People can feel hungover, they can have body aches. So if you know you have a high toxic load, start low, go slow, and then you can build upon that, or just plan, like, clear your schedule and you might be in bed for the next day or two.
Yeah, no, I'm glad you said that. That's a very good point, is to start low and go slow on all of this. Mm-hmm. I want to reiterate, this is a health journey. It is not a sprint. It is not, I'm still going through it. I've been going through it for several years now, but I am far better now than I was 2 years ago when I actually met you and got started on this journey. So I could talk to you all day. We're going to have another conversation again, Dr. Kat. But with that, I'm gonna go ahead and give you the opportunity to say anything last minute that you want to share with our listeners. And then please let everybody know how to get in touch with you. I will have all that information in the show notes, but would love to have you just let everybody know how to get in touch with you.
Yeah, absolutely. Okay. I want to say two things that I think are really important. One is, it's the hardest part of my job is telling people that their home is making them sick, because our home should be a sanctuary. Mm-hmm. So if you are living in a moldy environment and you are trying to detox mold, the analogy is kind of like you're standing under a shower with a towel trying to dry off. You're never going to get dry. So it is important to know, is my home a safe place for me before doing, tons and tons of detox. Secondly, there are websites out there, and the internet can be a wonderful place, and you can find support and solidarity and things to do. It can also be a very scary place that, saying, oh my gosh, I have to throw away absolutely everything that I own, and I have to sell my house, and I have to do all these things. And being in that really stressed fight or flight position is impossible to detox while you're doing that. So I can't emphasize enough the importance of mindfulness, the importance of, I call it limbic system retraining, the importance of getting into that parasympathetic state. And so, working on the vagus nerve is just equally as important, if not more important, than, detoxing super hard from all of the mold. And then ways to get in touch with me. You can follow me on Instagram. It's at Dr. Kat Bodden, my website. And I offer free 15-minute discovery calls for people, because I really want to make sure it's a good fit for us to work together. My practice, I really love to work with people who are motivated and they're ready to take action, and it's involved. And I just want to make sure now is the right time. I don't want to waste anyone's time, money, energy, or have them do anything that's not a good fit. So I'd love to chat with you on a discovery call. And if you're curious a little bit about my practice, I have a free gut health and inflammation mini course. You can sign up for that on my website, where you'll get a couple videos where I go through the importance of gut health and inflammation, learn some tips, and can learn a little bit more about me and my practice. So yeah, thank you so much for having me. I know we could talk about this literally all day. Literally all day.
I really could. And I am so just ecstatic that you were on the show, and we will have you on again to have more extensive conversation. So thank you again for being here. Thank you guys for listening. We'll catch you in the next episode.
Bye.
Bye.